Hello, everyone. On behalf of my co-authors, I would like to thank you for your interest in this poster on bleeding outcomes in participants with factor VIII activity less than 5 international units per deciliter post-gene transfer in the GENERATE-1 clinical trial. What is the background of this study? Mahlangu roxaparvovec, which is now approved by FDA and EMA, transfers a factor VIII coding sequence that enables endogenous factor VIII production in people with severe hemophilia A. In the GENERATE-1 clinical trial, the participants received a single infusion of 6 × 10^13 vector genome per kilogram dose of Mahlangu roxaparvovec, which led to the factor VIII production, which protected them from bleeding. However, there is a degree of inter-individual variability in the factor VIII expression for the individuals receiving the same dose. Also, we do know that the protective effect of low transgene-derived factor VIII is currently unknown. Here we report on the outcomes of the low factor VIII 3 years post-gene therapy. We included in this study patients with severe hemophilia A who were on prior factor VIII prophylaxis with no history of factor VIII inhibitors or anti-AAV antibodies. The 3 outcomes of interest in this study reported up to 3 years post-gene therapy, where the factor VIII activity as measured by the homogenic substrate assay or the one-stage assay. Secondly, the self-reported bleeds in the post-prophylaxis period up to 156 weeks. And thirdly, the return to prophylaxis during the 156 weeks, which is the analysis period. What are the results of this analysis of the 134 recipients of the gene therapy? This is the intention to treat population. 131 had completed 156 weeks post-gene therapy. At week 156, 46 of these individuals had factor VIII activity of less than 5 units per deciliter. Who returned to prophylaxis? Of the 46 with factor VIII activity of less than 5 units per deciliter, 8 returned to prophylaxis by week 156. 5 of the 8 had a median factor VIII activity of 0 international units per deciliter at 156 weeks. 2 of the 8 who returned to prophylaxis before week 156 had treated annualized bleed rate, which was higher in the post-prophylaxis period when compared to baseline factor VIII and prior prophylaxis. In 8 of the 8, the annualized factor VIII utilization was lower in the post-prophylaxis period when compared to baseline. What about those who did not return to prophylaxis? 38 of the 56 did not return prophylaxis by week 156. 5 of the 38, their treated annualized bleed rate was higher in the post-prophylaxis period when compared to baseline. And in fact, in all 38 individuals, the annualized factor VIII utilization was lower in the post-prophylaxis period when compared to baseline. Some of the reasons for returning to prophylaxis were many. They included the fact that individuals, in fact, needed to discuss this with their doctor and fit in with their lifestyle. Amongst other things, factor level was a consideration, their bleed rate was a consideration, and their desire for physical activity with some of the reasons why the individuals returned to prophylaxis. So what can we conclude for this study? We can conclude that most participants with low factor activity post-gene therapy in fact have low bleed rates. The annualized factor utilization is not a predictor of return to prophylaxis before week 156. It remains for me to thank you all for your attention, in particular to thank the participants and the investigators for their contribution to this study. Thank you very much.